Multisystem Inflammatory Syndrome in Children, or MISC for short. Guys, do you remember this? This is a condition that we were talking about a lot in April, May, the severe condition that we associated with COVID that was happening in kids, not commonly, but when it did and when it does, kids get very sick. They end up in the hospitals, in the ICUs. There have been deaths, and it's very, very severe. Well, today, the CDC released a report of kids that have been diagnosed with this MISC in the last few months. I'm going to tell you what typical age these children were, if they were male or female, what race they were, if they had underlying conditions, so stay tuned. But first, I want to go backwards just for a moment. We do know that kids, if they are infected with COVID, tend to have milder symptoms than adults, if they have symptoms at all. That is something we have known. But we also know that kids can get symptoms and they can also get severe symptoms, although this is less common. I want to remind you of what multisystem inflammatory syndrome in children actually is, the case definition. So what does it mean for a child to have this? Well, first of all, the child is less than 21 years old and they have a fever, usually high. They also have lab evidence of inflammation, and they have also clinical evidence, which means they look sick, they are sick, that requires hospitalization. That's how bad it is. And they have multiple organs that are involved, from the heart to the lungs to the kidneys to the GI tract, the neurological system, the skin, you name it. In addition, doctors don't have an alternative, plausible diagnosis or reason for the child having these symptoms. And finally, the child is positive for current or recent SARS-CoV-2 infection, or they've had COVID-19 exposure within the 4 weeks prior to the onset of symptoms. So that is our case definition for multisystem inflammatory syndrome in children, just so you can remember. Now, let's go to the CDC report, which has been tracking cases of this multisystem inflammatory syndrome for the last few months. I haven't talked about it much in the last few months, but the CDC has been tracking cases of this. They released a report, and this is what they found. They had 570 confirmed cases reported and 10 deaths in 40 states. Of the cases reported to the CDC, most cases were in children between the ages of 1 and 14 years old, with an average age of 8 years old. But cases occurred in children from as young as less than 1 year old to up to 20 years old. In addition, more than 70% of those reported cases occurred in children who are either Hispanic Latino or non-Hispanic Black. Guys, this is really important because we know that African Americans and minorities tend to be at higher risk for severe complications of COVID. We are seeing this play out in children as well. In addition, 99% of those cases reported to the CDC tested positive for SARS-CoV-2. That's not a surprise. The remaining 1% were around somebody with COVID-19. Again, not a surprise because this is a condition associated with COVID. But then we also found out that slightly more than half, 55% of those reported cases were in males. What's really important to note is that approximately 2/3 of the children did not have a pre-existing underlying medical condition before the onset of MISC, but obesity was the most commonly reported underlying medical condition. The majority of the patients were admitted to an ICU. That was 63.9%. Guys, I know this is scary. I know we're getting ready to go back to school, and parents and teachers, you guys are wondering, what do you do and what's going to happen? And we are all in the throes of trying to navigate this new normal. What I would say is that we need to remember that when kids do get COVID, they do tend to have milder symptoms than adults. That is a good thing, but yes, kids can get sick. But this is what you as parents and teachers need to know. Typically, children with MISC tend to get very, very sick. This is what I want to empower you to do. You know your children. You may also know the children in your classroom very well. If a child seems sick, really does not seem right, you make sure that you seek medical care for that child right away to make sure that they get adequately diagnosed and treated with whatever condition that they have. Trust your gut with this, and if a child looks sick, make sure that you act on this. Guys, I'll keep you updated as more information comes about. It's a good thing that the CDC is studying cases as they come in so that we can learn more about this condition and what we need to do. Please share this video with other people. I do daily health content, so if you're interested in daily health videos, please like and follow my page. And if you're interested in sending stars, I do answer your questions first. Guys, I'm Dr. Jen Caudle. I'll see you soon.